As of yesterday morning in Ontario, we had received 147,000 doses of Pfizer. And we had used, as of yesterday morning, just over 140,000 of those, and we're continuing to vaccinate people with the Pfizer that we had while we awaited the next shipment. That shipment arrived yesterday, just less than 50,000 doses of Pfizer, and yesterday afternoon and yesterday evening, it was already being put into the arms of people in those first two priority groups, those in most vulnerable circumstances and those of our healthcare workers. And we wanted to get it to them as quickly as we possibly could. We have ramped up the capacity to flow the vaccines through the 19 hospitals that are running mass vaccination clinics. We are piloting a project with the City of Toronto and Chief Matt Pegg to open up a clinic on the 18th of January to write the playbook for mass vaccination clinics outside of hospitals to utilize around the rest of Ontario. And while we're doing that, we're running an operation called Operation Remote Immunity, where we are getting vaccines into those in most vulnerable circumstances, particularly in those isolated fly-in communities. Some of them along the James Bay, some 31 of them that we want to get vaccinated because of their fragile circumstances. And we started last Thursday with needles in arms and several long-term care facilities in those communities and vaccinated 47 out of 51 residents, for example, and did more in Sioux Lookout itself with long-term care facilities and now moving to vaccinate the healthcare workers in the hospital there. All this to ensure that those in isolated communities and fly-in communities in particular have received a level of protection that they have not had till now. And we know that they are vulnerable. We know their medical system is not as robust as we all would like it to be. And if COVID-19 is introduced into their communities, it is going to be a massive tragedy, and that we want to help preempt. We have more than 175 people now as part of our team for that operation vaccinated, awaiting their second needle, and prepared to be the vaccinators and roll out in significant numbers that vaccination program, Operation Remote Immunity, into the 31 isolated communities starting on 1 February. And while we're doing that, we took the Premier's challenge and pivoted what we were doing because of our ability now to move Moderna, which had arrived as of last week, and because of our ability in the middle of the week to move Pfizer from the hospital sites where we receive it. We took the Premier's challenge to vaccinate all of the long-term care homes and the high-risk retirement homes in the four areas of Toronto, York, Peel, and Windsor, Essex. We are 75% along completing that mission. Some of the homes will be completed by 12, some of the regions will be completed by 12 January, others 15 January, 16 January, the last one by 18 January, we believe, and we will meet the Premier's challenge of vaccinating the residents and the staff in those long-term care homes and high-risk retirement homes who want to receive the vaccine and giving them that incredibly greater level of protection and eventually immunity from COVID-19. And while we are doing that, we have continued our pivot to start rolling out the vaccine into the long-term care homes and, again, the high-risk retirement homes around the rest of Ontario. And we've set ourselves a goal of 15 February that we will have vaccinated with the first needle all of the residents and the healthcare staff and the essential care workers and the essential people in those homes. We will have vaccinated them with the first needle by the 15th of February. That's all the long-term care homes and the high-risk retirement homes around the rest of Ontario, because even though they may not have an outbreak now, in time they would if we can't give them that level of protection that we want to give them. So we are now, with a capacity in Ontario, just with the sites that we have going right now, at least twice of what we have vaccines to administer. And so everybody is working hard, and I know right from the Prime Minister and the Federal Government of Canada, right down to the Premier here on my left and our ministers here, to get us more vaccines more quickly. We are ready to use them, and I talked to the Trillium Healthcare Centre, Michelle, CEO yesterday, Michelle and her team of leaders, and you know they can ramp up themselves very quickly with the program they are running to do more than 15,000 vaccinations a day themselves. And I saw an incredible program of vaccination where they were actually running 2 lanes, one vaccinating and using the staff from the hospital, one vaccinating using a paramedic team, which would then spin off and be completely ready to open another vaccination site whenever we need that capacity. We have immense capacity. I liken it to an 18-wheeler. We started the motor. We've taken our foot off the brake. We've really not put it on the accelerator yet, and we're only in about second or third gear out of 24 gears to go. and we've already got this immense capacity, which we will expand upon. We have brought the provincial health units with their medical officers of health, all 34 of them across Ontario, along with the CEOs of the hospitals who are running or going to run vaccination clinics, into our complete planning and operations framework, and they are working as fast as they possibly could, both to carry out those missions that we now have and to be prepared when we get more vaccines that show up in the province of Ontario. So our program is running. We're running flat out to make sure that we have more capacity than the vaccines we have, and as soon as we get more vaccines, we'll ramp up either further to get ready for what we call Phase 2. Phase 2 would commence sometime around the end of March or early April, depending on the arrival of large amounts of vaccines in the millions. And what we want to be able to do then is move from the first priority of those in most vulnerable circumstances, because we will have covered most of them and vaccinated most of them, or at least offered the vaccination to them, done the health care workers, and those will be continuing tasks throughout, because people will always be joining those into long-term care homes, or going into long-term care homes, or becoming an employee in long-term care homes, and people will always be joining the medical profession, so we will always be vaccinating some from those first two priorities. And then we want to work at the other priorities, and you can see it outlined on the board back here. We want to get at those who are most vulnerable, those in the age brackets 80 years old and above, and then as we finish vaccinating them and helping get the vaccine to them, working down the age brackets 75 and above and 60 to 75, and do it exactly that way. At the same time, we want to look after those and get vaccinating right away to those who are disproportionately affected by COVID-19. We are talking about some of the racialized communities, some of the communities around our province where COVID-19, as one of the doctors told me, the neighborhood is hot with COVID-19. We want to get to those populations clearly. That includes the urban Indigenous, and we're working now to how quickly we can get to those populations. And then thirdly, in Phase 2, we want to be able to give an incredible program of mass vaccination center support to our essential workers, and whether those are first responders like our incredible police and fire, and all the way through to the farm workers who ensure our supply of food, and many others besides. We're delineating how we will do those things, but we believe, given the millions of vaccines that are due to arrive in April, May, and June, and we've been led to believe by the federal government that during those 3 months we will receive 15 million doses of vaccine, both Pfizer and Moderna, that we will be able to run all three of those priorities concurrently, and that's what now the provincial health units, with our support and assistance, collaborating with the CEOs of the hospitals who are running vaccination sites, are now planning to actually be able to go out and execute. And what we want to do is be ready sometime in February to turn that machine on full speed. And that way, if we do get a surprise allocation in any way, shape, or form of vaccines arriving in Ontario that we don't have allocated right now, we would be ready within 96 hours to take those vaccines and start vaccinating people with them based on those three additional priorities. We want to turn that machine on and just warm it up and have it ready to go. You know, if something like AstraZeneca should be approved and vaccines arrive, we want to be ready for it. If more Pfizer or Moderna arrives earlier, we want to be able to get into, for example, a little bit earlier, those 80 years old and above. Those who are not in the long-term care facilities or the high-risk retirement homes, because obviously many of them are, but not all, and we want to be able to do our job as efficiently as possible for the people of Ontario. That's what the Premier has tasked us with. That's our mission, and that's what we're doing.